Hi everyone. Today I'm going to provide some reassurance words. We know in OET role play, sometimes we have to handle the difficult situations. Sometimes they are angry, they are worried, so we have to be empathetic to them and we have to reassure. So in that way, we can make a effective conversation between the patient. So let's see what are the reassurance words we can use here. There are some effective phrases. Just try to use it so you can make your role play well. The, See, Mr. John, it's not a serious condition as you might think. Because sometimes when they are worried, we can say it like that. Another one. I can see that you are worried, but try to not to be too concerned as this condition can be managed with medication and rest. So it will provide them some confidence. Another one. Let me assure you that you can overcome from this situation. We can tell that we have an expert panel here to treat this situation, and your doctor is well versed in this managing this disease condition. So try not to be get panic or no need to be alarmed like that. We can convince them. Another one is, see, Mr. Brown, don't be too panic. It is nothing to be get alarmed about it. It's just a simple procedure. Because when they are going for some surgery, like that we can tell them. Because we know the patient quite natural. It's quite natural for them to be get panic or anxious. So in that way we can convince them. Next one, when we are advising some patient to quit smoking or do some exercise or take medication properly, this time we can use that. See, Mr. Alex, I can assure you that if you follow my advice, the risk of future complications will be greatly reduced. Let's see another example. Sometimes the patient is explaining about their concerns and also difficulties. There is nobody at home to look after them like that. They are quite worried. So in that occasion, we can tell, see, Mr. John, I know it's quite overwhelming situation, but there is nothing to be worried. We can make all arrangements for you. Is it okay with you? Some patients, when we start conversation, they tell some complaints. They have this problem and they're suffering from this one like that. Then we can tell them, see, Mr. Brown, I totally understand your situation, but no need to be panic. You are in our safe hands. We have an effective strategy to cope with your situation. So, in these ways, we can reassure them and continue our conversation to make it an effective and live conversation. So, just consider them as patient. Don't think it's an interlocutor. I think it's clear for you. Thank you. Bye.